All right. Hey, everybody, and welcome to another episode of the Serdentity podcast. I am your host, Elizabeth Dewar-Anthony, and my guest today is my good friend, my mentor, my inspiration, and an all-around goddess. Her name is Shirley Gutkowski, and she has been working so hard to bring the field of orofacial myofunctional therapy forward. And I'm very grateful to her for her inspiration in my life. So Shirley,
Yeah,
what's up?
everything's up right now. It's a crazy time to be in healthcare for real.
Mhm.
And you have been also inspirational to me and to many, many, many other people. I'm so glad you really finally took the horns of this podcasting thing and just went for it. So that's what I'm excited for, because we need to get this information out. The more variations, the better.
Mhm.
So yeah.
So Serdentity, is about dental trauma and traumatizing dental patients. And but what dental professionals need to understand is there's so much more to this disease that their patients are carrying around than just dirty teeth. And I'm really over the whole dirty versus clean thing. It's shaming when people come in and they feel like they're dirty. How are they supposed to have a good experience?
Well, they can't. And hygienists don't have any other tools other than cleaning the teeth and flossing the teeth. And I think I've talked to you in the past. I was on one of the Facebook groups for dental hygienists, and I challenged hygienists to not talk about floss for one day with their patients. And you would have thought I told them to bash everybody's teeth with a hammer. It was unbelievable, the backlash from flossing, or they're just so floss first or scale first, or I'm like, really? This is such a low thing that we do, that it's just really unbelievable. We have so many better opportunities to help even humanity. That's where I'm at right now. It's a humanity thing. We have twice a year where we can talk to our patients about changes that they have made to their own DNA without even knowing about it, or
Mm-hmm.
suffering with the changed DNA that happened from their grandparents or even their great grandparents. So we have a better opportunity to solve the healthcare crisis than just asking people to effing floss their teeth.
um, Emily Stein was talking about that, about epigenetics, and how in real time these bacteria are adjusting to our body
Their
chemistry.
environment. Yeah.
Yeah. So we need to stop approaching the oral cavity as if it's some sort of fixed thing.
And separate.
Yeah, fixed and separate. um and as long as we continue to come at people with brush, floss, drill, fill, there we are going to keep traumatizing people, and it's so not necessary.
Exactly. I wrote an article years ago for RDH magazine calling out this idea of dental phobia, and that it was a misnomer, and that we should not be using the term phobia, because that is an irrational fear of whatever
Right.
it is.
Right.
And I was like, dude, all of these people that are afraid of dentistry are afraid because it was learned. They learned to fear dentistry because someone abused them along the way. Everything from the velvet glove. Do you remember that?
No.
The velvet glove technique was a pediatric dentist or a dentist working on a child that was misbehaving would put their hand without a glove, right? Because this was before gloves. So I'm
Right.
sure it smelled like cigarettes or chewing
Right.
or a
Ew.
cigar. And they would cover the child's mouth and nose until the kid was like, holy crap, I can't breathe. I better shut up. So that was their entry into dentistry. And then they are like under the drill as a punishment. And so they were, the dentist would often withhold anesthetic, or the parents would not pay for the anesthetic.
Yeah, charging extra for anesthetic. Like, what?
They don't deserve it. I tell them to brush. This is not a brushing and flossing condition. That is my newest flag that is already 10 or 15 years old. That dental decay and periodontal disease are conditions of the system expressing itself as a dental condition. So something's wrong in the interior, in the systemic body, that is expressing itself outwardly as dental decay or dental or periodontal disease.
Well, sometimes I wonder why we continue to be surprised that patients have dental disease, that they have, oh my God, you have inflammation. Why are we still surprised?
Not because of a lack of flossing, for sure.
How do we expect people to not have inflammation when your mouth is connected directly to your bloodstream? There's tons of bacteria, and we are feeding that bacteria so well. Of course it's going to get in your bloodstream. Of course your body's going to react to it. Come on.
We all have heard of leaky gut syndrome. There's also leaky gum syndrome. So once you start killing a lot of this bacteria, they have oh my gosh, I can't think of the term now. So LPS, lipopolysaccharides, that are breakdown fragments of the cell walls of these bacteria. And that is a toxin to the gums, and it spreads apart the tight junction in the epithelium. So now you have not a tight junction. So if this is a cell and this is a cell, a tissue cell, a gum cell, they are glued together with little fibers, and those little fibers get dissolved in the presence of these LPSs. And then you have a leaky situation. Now, in the gut, you have things like poop getting right into your bloodstream and some other nefarious things. In the gums, you have these pathogens that are getting into the bloodstream really easily because of this tight junction. How does this happen? Oral breathing is inflammatory on its own. Snoring is more inflammatory than periodontal disease. I'm sorry to tell you, hygienists, you're barking up the wrong tree. Then you have a low pH environment in the mouth because of mouth breathing. Low pH environment is the perfect environment for periodontal pathogens. So now you have more periodontal pathogens. That's how they get into the brain. And that's how they're being tied in together with things like Parkinson's and Alzheimer's. So this is part of the whole mechanism of what's going on. And us blaming the patient for not flossing is part of the problem, because patients have to lie to protect themselves.
Right.
So now they're in a very dicey situation. They have to lie to their hygienist, or they have to go into this charisma routine. Well, I don't floss as often as I should. At least I'm honest. Right. I used to tell them that honesty won't save their teeth, you know?
Right.
But I didn't have any other tools. And we know so much more now, and so much better now, that some of this is coming directly from their grandparents' diet. And that is not anything that people are talking about right now.
We'll talk some more about it. That's fascinating.
Because it's the epigenetic changes. So people are breathing with their mouth open more and more because their jaws are not growing.
Right.
The jaws are not growing because their great grandparents or their grandparents were eating an inappropriate diet. So now we have an inappropriate diet, and that's affecting growth and development. We're feeding these people, these kids and their parents, which is why we have those epigenetic questions now on our health history. they are eating plant seed oils. And once those plant seed oils get into your entire system, none of the cells work correctly. So that's a whole nother piece.
Wow.
So now the DNA that's going to make the next generation is like, holy cow, there's no appropriate fats and there's no air. So we're going to come out small, and we're going to come out with these weird cells that aren't going to make vitamin D, for instance.
Oh my gosh.
So now we have a whole situation where you're going to be easily overcoming it if you're the first generation on this inappropriate diet. But the second generation is going to be really suffering. So we see this really very well when you start putting out a timeline where patients in my age group, I'm a boomer, I'm at the end of the boomer line here, they have all their teeth now, right? You
Right,
know,
right,
our generation before us, my mother probably has 8 teeth left. She
right,
has partials all over.
right.
And so now people in our age group, you're a little younger than me, but everybody has implants because they had teeth taken
Right,
out and now they
right.
have implants. And now we have even a smaller mouth because a lot of these people have had their teeth removed for braces.
Yep.
So now you have no room for the tongue. The tongue is sliding back into the airway. And now you have, if you're a woman, you have a situation of hypoxia where you have low oxygen, and that tag of low oxygen environment is on all the eggs you were born with.
Wow.
Right?
Right.
Because you have an allotment of eggs as you're born.
Right, right. You're born with all the eggs you're ever going to have.
Right. And the girl baby that you're developing in your womb is also developing all the eggs she's ever going to have. So if you're in an hypoxic environment, your eggs are damaged, and so are the eggs of your daughter. The sperm cells translate, right? They regrow, they turn over every 3 or 5 months or whatever. So it's not that big of a deal for the guys. Some of these changes do stick with the sperm. So we have that too, but for sure on these eggs is where we're seeing a big problem. So now we have a situation where you have to breathe through your mouth. You don't know why. You have these orthodontic problems starting at, 3 years old. The dentist's like, well, you're going to have to save up for braces. And so this is why all of this is so critical, that we get on board with this kind of thinking, that we stop yammering and yelling at our patients. You know what I tell our patients? It's your great-grandmother's fault. She's not around anymore. That's okay. She didn't know any better. So we can, with good faith, stop blaming our patients for their disease. It is a generational thing that occurred because of outside influences on the food chain. So there are 2 books that are super good for this. One is Metabolical by Dr. Lustig, and the other is, I don't know the name of it, and it's that other podcasting. I shouldn't have brought it up now. I'll figure it out now, and we'll put it in here somehow. It's about the food system and how the pyramid was developed, and how the paying farmers to grow this, not that, has been influential, and forcing parents to start feeding children grains very early. The grains is a big problem. Infants are born into the world in ketosis. When we start breastfeeding, we are feeding them high fat food. If you're using animal fat, right? So here we go again with the plant versus animal fat. So now, not only are you feeding the baby a high fat food, you are also keeping them in ketosis. And then at 6 months, you're like, this kid is driving me crazy. I wish he would sleep through the night. And what do you feed him the very first food?
Right. Rice cereal.
It's rice cereal. What does rice cereal do to ketosis? Takes you right out.
Right.
Yeah.
Because it's a starch.
It's a starch. And what else does it do? It ramps up the pancreas to start kicking out insulin. And this is where we start. Nobody else is saying this right now as strongly as I am, but this is where we start with diabetes.
Yeah.
And if you think about this through the generations, as I just laid out, I hope it was clear. Now we are on so my brother had rice cereal and he was born in 68 and I probably had it and I was born in 58. So we're on 1, 2, 3.
Oh, since World War II, right?
Generation
40s, 30s, yeah.
On these inappropriate diets. Now you start so now we have this high insulin reaction. So now we're in the 4th generation of high insulin. So now we have infants with fatty liver disease, which used to be, oh, this thing cracks me up. You know, when you talk
right?
and put your hand like this, it raises your hand and sticks you on the other side. Oh my God, that's so funny. So now we have this whole situation where we have this high insulin. We have babies who are born in ketosis of an inferiorly fed mother, even though she's following all the guidelines.
Right.
And now we have these damaged DNA strands that are going through the generations. Now we have, I was going to say fatty liver used to be only for alcoholics, adult alcoholics, right? And now we've got Dr. Lustig talks about his 6-month-old patients with fatty liver. And obese, like obese, you know, everybody wants to see a pudgy baby, but nobody wants to see one that can't get themselves to roll over at whatever time that is.
Right.
So that's where we're at right now. The ketosis thing, I think, is a missing story. Nobody wants to really study infants, you know what I mean? Or pregnant women. So it's really hard to get to the bottom of it.
Yeah.
But that's where the science is leading me, at least. So,
well, so the Gerber family made a fortune convincing American parents that they needed to feed their baby with a spoon. So not only are they not eating food that's nutritious, but they're also learning how you're
pre-chewed.
Yeah, you're teaching this kid how to have a tongue thrust, deviant swallow, because when you come at a baby, they're with a spoon, their brain's going to be like, hello, you need to protect yourself. So
yeah,
it's a miracle that any of it. How are we still alive? I don't get it.
I don't know. I have no
How
idea.
are we surviving?
I don't know, but it you know, that's the reason why I named our business Primal Air. You know, I really want to come at this from a primal perspective. And if you're not mimicking the primal times before agriculture took over, then there are improvements to be made. So that's how I come at all of this. And, you know, you're never going to be able to get perfectly primal.
Right.
But we have to start, all of us have to start doing it right now so that we can save our generations. Probably the most telling video I've ever seen is the Pottinger cat study video.
Right.
Still free, still short. You know, you got to wonder, you know, it's a really old video. And, you know, did they really have videos back then? You know, we start all these
questions. They had a camera.
They had a camera. This guy was doing this.
Right.
But it's, and I always think, well, what if it's half wrong? What if it's only half right? It's still shocking. Shocking. And the humans are now mimicking what was happening to those cats. Asthma increased, fertility decreased. They're saying that young men today have only half the sperm they did in their father's generation.
Wow.
The lack of interest in sex is in the papers now. It's just everywhere from both sides. It's very, very, very bad. We all need to get on top of this problem. I'm sorry, we're kind of off the Serdentity.
No, it's wonderful because
Yeah.
this is what dental people need to hear and
Yeah.
to understand that it's not, the mouth is not separated from the rest of the body. And
the mouth runs the rest of the body.
yes,
it runs it. If there's a problem with the tongue, the whole system breaks down. And I think the more that we're learning, you and I, Beth, about myofunctional therapy and the benefits of the tongue, mobility, the mobility of the tongue, it's like, holy moly, everything keeps going right back to the tongue.
And the tongue, I don't remember a darn thing about the tongue in dental hygiene school, that freaking one room schoolhouse with the little chalkboard there. So to me, the tongue is something that you need to get out of the way while you're trying to do some work in somebody's mouth, because their mouth is dirty because they don't floss. And by the way, they're like totally rude. So,
and they're complaining. If they would floss every day, it wouldn't hurt so much when I did it.
Right. It wouldn't hurt so much.
They floss twice a year, whether they need it or not. And I'm the one doing it. So yeah, no, it's terrible. It's so easy to get slumped into that routine. I used to have to fight it all the time. I'm with you, with my colleagues. It was just like, just stop talking like that. We don't talk like that about our patients, you know. It's not professional.
Well, so just yesterday in one of the dental hygiene Facebook groups, hygienist was complaining about it's exhausting having to talk. You know, that hygiene is so repetitious, it's boring, blah, blah, blah. So I replied, well, focus on the patient. Every patient is different. And if you focus on
every
them,
time.
And then the person replied, well, I tried that and I was so exhausted. So I was like, so I included a link to how to be empathic without, taking it on. You have to learn. That's a skill.
That's a skill. Yeah.
And it's just, it can be learned. And, then some other person jumped on and was like, well, I'm not there to, I'm not saying that I'm there to be a therapist, but I'm saying that, it's
they don't
really,
like that.
It's really important for me to understand. Can't be
the floss whipper, the floss nag, then they don't know how to be, and they really need to get off of that for real.
And yeah, I mean, it's so important for me to know what's going on with my patient. And it's not hard. You look at their medical history, okay? Like, what medications are they taking? That's going to give you a lot of clues right away. And once you learn how to recognize what a person with an impaired mouth looks like, my new best friend, Dr. Felix Liao.
Isn't he awesome?
Oh my gosh.
You should have him on like 4 times.
Yeah. He's so dear. Oh, my daughter wants to do another podcast too. She loved it.
Oh, she's really great. Yeah.
Isn't she?
I can't wait for that too. I did listen to that one, the whole thing.
So, once you learn to recognize these, from the medical history, from, you look across the waiting room and you can right away, and it's not judgment. It's not like, this jerk. It's, oh, there's Mr. Jones. He's got a deficient upper lip. He's got no chin. And, and I'm already, okay, taking this into account. And then, by the time we walk back to the chair and Mr. Jones is all crabby and defensive, I can sit with him with the medical history and look him in the eye and say, hey, and, explain things about patients don't understand. Like, they're taking all these medications. Oh, I don't know what they are. My wife just puts them out for me. I'm like, okay. I'm like, you better not make her mad, buddy.
I usually skip the blue ones,
right?
Or the whatever color ones, the yellow ones.
Just teach them a little couple things about, you're taking this medication because of this issue in this area of your body, and approaching these people not, as a healthcare provider that's working in their mouth, not as a dirty tooth cleaner.
Yeah. No, we have to start with a better, we can start with a better attitude, and we're going to be healthier from it. So that's what I like about the Serdentity idea, is that not only are you honoring the patient more, you're honoring yourself more.
Right.
And you can have an easier day. You know, as a clinical dental hygienist between 1986 and 2003, I was on the carpet a lot for you name it, asking the assistant to actually assist me, to, barking at people. I got called in once because this guy was like looking at his watch, and I'm like, I'm like, he must be in a really big hurry. And I'm like
Right.
going and hurrying. Oh, I got done too fast. He couldn't believe that I had done a good job because he was in and out of there, nothing flat. And I was like, you have to be flipping kidding me. Unbelievable. So anyway, so I was on the carpet a lot, but I never got onto the carpet for not cleaning somebody's teeth, for sitting them up and listening to their yammering about whatever it is was the problem. Everything from fights with the neighbor lady to miscarriages to, I don't know, I never had a husband cheating story, but it's they have their story and they're bringing in their baggage, and they can't monitor everything. They can't do everything. So I was just there to act as a sounding board, and I never got in trouble for that. And that's what I think most hygienists are missing, that they feel like they have to do it like you did it in school. Every part of everything today, right now, no matter what. Because if they sit up and they tell you their sad story or their happy story or whatever story they feel like they have to tell you, you can gently say, we might have to reschedule your appointment. They're thrilled with that. They're so happy to come back because they got what they really, really needed. They did not need a flossing lecture. Anybody over 40, you should never talk to them about flossing. They've already had that lecture. They're doing it the best they can, regardless of what you're going to say, So that's what I think all hygienists and even dentists need to really get on board with, that it's not getting checked out.
Right.
And the patient is not going to come back for another 4-hour appointment. They're going to come back for another, 30 or 60-minute appointment. So it's not going to be a huge impact on their day. And you can feel them out in the first 10 minutes. We might have to reschedule if we can't, get things done. Well, let me just lay down and just let you get to work. And then they stop you and then they keep talking. It's okay. Because now they know they're going to have to come back if they can't stop talking, or their breathing is impacted. The stuffy nose and so there's just so many things that will interfere with a hygiene appointment.
Well, and when people at the end of their hygiene, their cleaning, they're not even clean. Okay. That first quadrant that I scaled is already repopulated.
Yep.
So why do we dismiss these people, or we're finished? We're not finished.
It's never ending. That's what I think.
It's never ending.
So it's never over.
So we're getting them. We do the best we can for the time that we have with them, but we have to stop acting as if that there's somehow sorry. That somehow their mouth is better, after 45 minutes than it was.
Yeah. Yeah. And the other thing is the retained calculus, and the hygienist that was here before me. Oh my God, blah, blah, blah. Maybe she was a really good listener, and maybe this patient was not tolerating the mirror or the suction or whatever it was. And there were mitigating circumstances. Maybe you're really good at helping the tongue relax during an appointment so that you can get to the, the distal of tooth number 3. It's not that easy, But if the tongue is especially involved, then it's even harder. And if you can't help the tongue relax, and if you can't make sure your patient can breathe, then you're missing the boat.
And patients really appreciate that little bit of, information, education. This is a reflex. Okay. I know you're not doing this on purpose. Your tongue
Right.
is doing its job.
Yes.
Your tongue's job is to protect your airway, and your tongue is killing it. Your tongue is doing a great job.
Yeah.
But and the whole calculus, it's not even about the calculus. Because we've all seen patients come back and their tissue got healthier, and there's all this burnished calculus that you can see on their roots. So it's not about the calculus anyway.
Right. It just makes it a little bit harder for the bacteria to be accessed when you're cleaning the teeth. And, the tongue has other jobs. During the children's development, the tongue has to be pressing against the palate in order to make enough room for the teeth.
And it hardly ever is.
It's very, very difficult because of the diet, because of the methylation, which I don't understand 100%, but this way of dealing with the foods that we're eating is interfering with the body's ability to release the tongue from the floor of the mouth. Mm-hmm. And if that tongue cannot get away from the floor of the mouth enough, if it's not mobile enough, it cannot press into the roof of the mouth. So that's where this is the number one thing, right? Because most hygienists don't see a kid until they're 3, right? It's very rare. So if there's no space between those baby teeth, that's a low tongue posture problem. Mm-hmm. If there's not a nickel's worth of space between the teeth when they're 5, that is a tongue problem. If the baby can't nurse, it's not a formula deficiency, it's a tongue problem. This is another big part of medicine that's gone just a little bit haywire. They have separated the breast from the milk, and they're trying to mimic the milk by all of these formulations. And they're trying almost a little bit to create a bottle nipple to mimic the breast. They've not been very successful at it. And so that whole system is what grows the arches so that you have enough room for teeth. It grows the sinuses so that you have room enough to breathe. It makes the sinuses give enough room around the turbinate so that the air can circulate. Mm-hmm. It allows the the nitric oxide to come out of the nitric oxide producing cells, which is a whole nother thing. And then just on and on. I mean, there's just so many things that happen when the tongue is engaged with the palate. The orbits are the maxilla, this bone that holds your teeth in, is the bottom of the eye socket. Mm-hmm. And then if that's not growing, what happens to the vision? Right. How many kids are you seeing now with glasses where you were in elementary school and only the teachers had glasses? There was maybe one kid that had glasses. Wow. So now we've got this vision thing. Now the sphenoid bone is also attached to the orbit floor. And if that thing is out of whack, we've got about 9 of the 12 cranial nerves coming through that bone. Right. And the pituitary gland is sitting on that bone.
It's like a little bowl for your pituitary gland.
If that bone is not right, your pituitary doesn't work. A lot of the cranial nerves that adjust your vision, your taste, your mouth, everything, your head, your cheeks, all of that stuff is affected. It just continues to go on and on. That's why I was saying earlier, everything seems to come right down to the tongue.
And the tongue, I always tell my patients to think about a giraffe.
A giraffe, yes.
How long their tongue is and how it wraps around. Like, we could do that, we just don't. take a little
We
work.
don't have to. We have silverware.
Right. You probably couldn't do it the first day, but and we could carry grocery bags with our tongue. We just don't. And horses, the way they use their lips.
Yep.
I can't even move. I can barely move my lips without moving everything else. These muscles should be independent and also working together at the same time. And that's, they don't have to, because we don't have to chew anymore. In metabolical, Dr. Lustig talks about sugar, the sugar industry and the pharmaceutical industry, right? I mean, like, we start these kids out on sugar, and then then the pharmaceutical industry jumps in when they're middle-aged to start to try to undo the effects of all this sugar that they've had all their lives. And everyone's this whole breastfeeding thing, but our culture doesn't support it at all. No. You got these poor girls pumping their breasts at their job rather than just staying home with their baby.
Because it's about the milk. They always only ever talk about the milk.
Oh my God.
Right. And that's a great improvement. But we still need the mother to be with the infant. I never thought I would hear myself say this. I left my baby after 2 weeks and went back to school. I was like, these little tiny babies, they don't need their mother. They don't even know I'm here. But there goes the hand
There's your hand again.
But what really happened is that because we're standing, because humans stand, our pelvis has misshapen. And if the baby were to be born at its appropriate age as compared to other mammals, it would be 6 months later.
Yeah.
So our infants are born 6 months premature as compared to other mammals, our size and whatever.
Is there research talking about that? Like,
oh yeah,
people, they were pregnant much longer than we are.
There you go. So it's a nice piece of information to have, and it helps you then understand why we have to have better maternity plans. And they want the employer to pay for that. Well, why don't you just get a smaller house? Get an older car and put that money aside and save a year's salary as you're waiting for this baby to come onto the scene. You can take more control. You don't have to put the burden on society. My son and daughter-in-law I don't think they have 1,100 square feet. They have a 2,000 square foot garage because they have money for all their toys. They have snowmobiles and boats and workout equipment and climbing, they have a lot of habits, but they don't have all of their money stuck into their home. So, and she can clean the house in like 45 minutes, there's that too, but they took control. They took control of their own circumstances. It would be nice if the government paid for a year's worth of blah, 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 but then all of our taxes would go up. Or for the dentist to pay maternity leave for a year, and then everybody would have to pay an extra $100 per appointment. It's just, it doesn't just appear. Everybody needs to plan. So that's my suggestion for all of that, because we do need to be with our babies longer. We do need to understand that breastfeeding is natural. It is evolutionarily inconsistent to say that breast milk causes cavities. It is evolutionarily inconsistent to say that a mother's milk will dry up in 4 months. I cannot believe how many times I hear that. 4 months. So weird. It's evolutionarily inconsistent that every mother that has a baby at this or that hospital has flat nipples, old nipples, round nipples, square nipples, blah, blah, blah. Just so many things. It's not evolutionarily consistent. So you need to look further. And this is why I wrote my new book. Thank you for asking.
Oh, right.
I think it's at the printer. It's finally at the printer. So it's called More Than a Kissing Spot, Your New Baby's Face. And it is very short. very easy to read. It has some big words, but I do a pretty good job of explaining, I think, for parents to be, so they know what to look for in their baby's face, that the tongue should be moving, that it shouldn't look like a whale tail when they're crying, just stuff like that, and why it's important. And I feature my little grandson, Malcolm, because every picture they send me, zip, zip, zip. I think that's the first baby I ever saw with a closed mouth.
Wow.
I really, really don't think that I've ever seen a baby with a closed mouth. I just don't. It's never even been in my mind that a baby's mouth is open or closed. It's supposed to be closed, everybody. It's evolutionarily inconsistent to snore. It's evolutionarily inconsistent to wet the bed past infancy, right? Kid urine stinks. Infant urine does not. I mean, just put all of these things together. We need to revisit. We absolutely need to revisit. So it's at the printer. If anybody wants it, we'll put it on a link, underneath this video on how to get it. It's not on Amazon yet. It's taking forever.
Well, it should be, for every baby shower, it should absolutely be.
Absolutely. If you're working at a pediatric dental office, it should be in your waiting room. It should be a gift for all of your new people. So it's, once you know this information before you have the baby, you can act on it. People that have a baby, you only had the one, so I don't know if you remember how stupid you are after the baby comes.
Yeah.
It's really, really like you lose brain cells. But what's really happening is that your complete focus is that baby's survival.
Right.
That's it. That's the only energy you have. And if you have to go back to work in 4 to 6 weeks, you are still in this mommy protective mode. And so you're fighting all the time against that innate field, that innate thing. So in the book, I also talk to, the father or the birthing partner, whatever term we're using to illustrate that person that's not the birthing person. That person needs to believe the mother. If the mother says there's a problem with nursing, even if she's gone to 6 physicians and all of them said, no, there's not, here's the formula, fed is best, then no, the mother's right. And you need to continue to look, and you need to continue to act on that. So that's the short end of it. It just really is a problem that started in the 40s or 50s. And then, when you talk about traumas and how traumas carry through, you've got a really good handle on traumas. But in the 40s, all the fathers or father age,
right, they were all gone.
They were in wars.
Yeah.
They were exposed to war. And that also affects not only the sperm, but the whole attitude of the father. And so there's a distance there, and there's this, and there's that, and there's all this other kind of stuff. And that gets traveled on throughout the generations as well. So, it's been going on for quite some time. And you put these bad foods on top of it, and then it just continues to magnify. And we need to get on it like yesterday in order to fix this problem.
So, wow, we've been talking for 50 minutes. So
I need another hour.
Yes. So we're going to have to do this again, because there's no shortage of things to talk about. And it's so exciting to be on this side of this, to be able to give our fellow professionals the information to help them understand, how things are working in their patients' lives. And so that, we can all stop. It helps me to know that there's all this other stuff going on. It's not just that this patient is, bad, wrong, or dirty.
Yes.
It's
yeah.
So, and we want to elevate our profession. We want to stop, slam, shame, and sell, and we want to, start providing real health care.
And we want the hygienists and the care providers to relax a little bit and
Yeah.
have a background understanding of what the whole thing is that they're confronted with,
Yeah.
that the patient is bringing into the appointment, because that'll make your job a lot more fun
Yeah.
and a lot more relaxing and a lot more serene. So, and you won't have to
Serene.
go and yes, you
My
don't have to go to the
favorite word.
tavern right after and start drinking wine. So yeah, so the serenity thing and the serdentity thing are real.
It is real. Well, I know you have a patient, so
Yep.
gotta let you go. But it's always wonderful to speak with you, to listen to your knowledge, and we'll do this again.
Sure thing, anytime.
All right. Talk to you later.
Thank you. Bye,
Okay.
everybody.
Bye.